Okay, so next up we have David Trainor, who is the founder and CEO of Sentireal Limited, a company that specializes in augmented and virtual reality, as well as AI and machine learning. For those of you who understand what that is and means, David's been very supportive of us on our network, and it really shows the value of having an industry partner and some of that in knowledge to kind of guide us and walk us through, quite frankly, some things that we don't know and are unlikely to ever find out ourselves or through using Google. And so David's going to talk to you a wee bit about kind of his work and some of the stuff his company does in relation to mental health. So thanks.
Okay, thanks very much, Paul. Good morning, everyone. As you heard, my name is David Trainor. So I run a local software and media company called Sentireal. We're based in central Belfast. So we've been working in the, virtual reality, augmented reality, multiple realities type of space for about 5 years, predominantly in the area of education and training, although health-related education and training, and latterly mental health education and training has become a really important area for us. We're really happy to be part of this network. As Paul mentioned, we've been part of this since the early days. It's proved to be a really fruitful relationship, for us, and it's great to have this event today. What I actually want to talk about this morning then is a particular project that we've been involved with, which really just gone through an initial, 6-month proof of concept type of stage. But it's looking around the idea of creating very highly personalized virtual reality experiences for the purposes of delivering clinically approved forms of mental health therapy, predominantly for mild to moderate depression. So in terms of, a little bit more generally what we do, we at Sentireal, we provide software and media platforms. I guess we summarize what we do under the strapline personal immersive learning. So learning, obviously, because we're involved in education and training. Immersive, because we're using technologies like virtual reality to provide that training. And then personal is really where the AI and machine learning part that Paul alluded to comes in. So specifically, we're looking at how can you improve virtual reality experiences by capturing data and analyzing what a person does in this 3D world, computer-generated world that you've created. Measure that against some kind of standard, an education standard, a training standard, a therapeutic standard, and then start to automatically adjust the next set of virtual reality media or content that gets sent to that person as a result. So the idea being that over time, each person, although they're being educated or trained in the same theme or the same area, starts to get an ever more personally relevant form of media being delivered to them. So that's really where we're blending this. So the term extended reality here is a catch-all term for virtual reality, augmented reality, and a bunch of different types of immersive experiences. But trying to blend that with machine learning and artificial intelligence, really to create more personalized and more personally relevant experiences. But we also reuse that same data to carry out a form of assessment and visualization of that training back to authorized experts. So example would be in the mental health world, where someone's undertaking maybe a self-guided mental health therapy using VR. You're capturing aspects about how they perform and interact with that content. You may want to visualize those results back out to an authorized clinician or therapist who could then interpret how a person is progressing with their treatment as a result of that. So as I mentioned, I think some of the former speakers have talked about this as well. There's really two, in the overall application space that we work in, there's really two key areas. One would be the use of immersive technologies as a means of providing education or pedagogical information for healthcare professionals, whether that's in terms of helping them to carry out some kind of technical process or situational process. So in terms of the social sciences or social work world, could be putting people into certain situations in terms of practicing skills or experiences that would be difficult to logistically difficult or financially difficult to create. What I'm going to talk about this morning is more the second form, I guess, is where we're actually using immersive technologies to deliver some form of education or guidance, or in this case, mental health therapy, to the public, to a patient, to end users. So we've done work more recently in mental health. We have a long history actually of working with the autistic community in terms of providing them with immersive applications to help them manage their mental health, but also as a means of help guiding them through certain social situations or so on that they may otherwise find challenging, so that when they have to do them for real, it's less onerous for them. So as I mentioned, our main project in the mental health therapy area has been around a proof of concept app we've created for virtual reality delivery of clinically approved mental health therapies, in particular aspects of cognitive behavioral therapy and mindfulness-based cognitive therapy. So these are obviously well-known clinical and therapeutic techniques. What we've been looking at is ways of taking some of those concepts and delivering them and reimagining them in a way that makes best use of virtual reality as a medium. So as I mentioned, we're looking at also at personalization in an automated way of that VR content. So as people go through various therapeutic exercises, gathering data and then adjusting the VR media that's sent to them subsequently based on that. Predominantly looking at home-based, self-guided forms of therapy. So we're actually, in virtual reality hardware terms, we're looking at the consumer low end of virtual reality technology, whether that's smartphone-based or whether it's one of the low-cost standalone headsets that are very common nowadays. But also offering the capability of therapist-guided variations, where there can be a live link to a remote therapist while a person's in the virtual environment, or group-based scenarios, so bringing in a kind of a character or avatar-based aspect to the experience to facilitate that. So this has been funded actually, well, indirectly through NHS England, but through SBRI Healthcare. So it's a small business research initiative, which is a funding initiative, works throughout the UK, but there's a specific body that funds these for healthcare-related projects. So as I say, we received some funding to carry out a 6-month proof of concept, which finished at the end of last year. So the pictures here then just show a few stills from various aspects, various areas of the VR experience. So we have, over on the left here, we have part of a mindfulness scenario, a meditative scenario. We have a library area here where people can find out more about the rationale behind some of the therapies that they're being asked to perform. And then over on the right, we have a courtroom type environment, which we actually use as part of a thought challenging exercise, which is a classical cognitive behavioral therapy technique, which I'll get to. So for those of you maybe not coming from a clinical or psychology or psychiatry background, just in terms of the sort of things that we're looking at here, from a therapeutic sense with cognitive behavioral therapy, which is really looking at how thoughts, emotions, and behaviors are interlinked. This is sort of a fairly classical model of that. In terms of what we're bringing into VR, we're trying to create scenarios that are looking at some of the classical faulty thinking or cognitive distortions that would be documented within CBT, and present those rather than being pencil and paper exercises or thought exercises, create narratives and hence VR scenarios that can let people engage with these type of therapeutic approaches. And then mindfulness-based cognitive therapy, again, bringing in aspects of mindfulness-based theory, being in the moment, carrying out various exercises, breathing exercises, body scans, and obviously building this up into a daily practice. So as I mentioned, one of the key challenges we've been looking at is taking some of these existing therapeutic approaches and exercises, which are normally or traditionally been carried out as thought exercises or pencil and paper exercises. If you translated those directly into virtual reality, which is a 3-dimensional computer-generated interactive environment, they wouldn't work very well. So a lot of our design effort has been trying to create narratives and scenarios that have that three-dimensional and interactive aspect, and then reimagining some of those therapeutic exercises in that context. So the example that I gave earlier is a good one. So thought challenging is the classical CBT technique. You state a negative thought about yourself. You then start to argue back and forward and provide evidence for and against that thought. And at the end of the exercise, hopefully you arrive at a more rational perspective about that thought. So we cast that then as a LA Law style courtroom drama where you state the negative thought. That's recorded as audio using the headset microphone. Your thought is then placed at the end of the courtroom, and then you start assuming the role of the various attorneys, and you start stating the evidence either for or against that. When you're finished, it then plays that back as a courtroom style drama, and then you can analyze obviously the inputs that you gave at each stage. So that's just an example, but really what we're trying to do here is take a therapeutic scenario and make it fit with virtual reality, which is obviously a three-dimensional environment, so you want to make full use of the three-dimensional space that you've created, and also the fact that you've got interactivity. So you want to be able to make full use of the fact that you have agency and interactivity within virtual reality. You have control, you can interact with the various objects in your virtual scene. So trying to reimagine some classical CBT and mindfulness techniques in that context. So I've got a short video here. I've muted the audio just so I can talk over it, just to show you some aspects of this environment. So this is kind of a centralized hub area that lets you navigate to different areas, different sub-areas within the world. So you can go to the library to find out more about your therapy. You can go to a thought journaling area. There's a companion smartphone app with this that lets you record thoughts, and then you can go into this area when you have your VR session, and you can then recall, analyze those thoughts from your thought diary. You can add additional notes. You can create little snippets of audio dictation that you can add to those. Let's just advance this a little bit quickly. So then the baubles at the top there represent the various thoughts that you've captured. So that's a timeline, and they're color-coded then to reflect the various mood or emotion that you expressed at that particular, when you captured that particular thought. So this is another area of the app then. This is more for a mindfulness meditative type of experience here, where you're taking part in various body scan or breathing exercises. Because of the personalization aspect, then aspects of that environment will change over time for each individual depending on how they interact. So this is the courtroom scene that I mentioned for the thought challenging exercise. So as part of the challenge as it goes back and forward, basically you're activating a virtual microphone, you're making a statement, either for or against your negative thought. That gets captured, and then that process continues, and then the entire scene is played back at the end. And then there's finally just a simple library area where we have, for people who are interested in finding out more about the underpinnings or rationale behind some of the therapies that they're being asked to carry out, can get some kind of reference literature in that library. That's just a quick overview then of, I suppose, where we've got to with this particular application. It took a few months to basically to build that. What we're intending to do with this, obviously, is to continue to develop, to add in more of the various exercises that are inherent within CBT and MBCT therapies. Actually, as part of developing this, we have already had interactions both with clinical expertise, with a consultant psychiatrist, and also we've had a small user group of about 15 to 20 people who have been actively testing this and providing user experience type feedback to us as well. So hoping to expand that effort and hopefully take it forward. So again, just a small example of some of the work we've been doing, but certainly a strong link, obviously, with the mental health themes inherent in this network. So thank you very much.